I'm Dan Jamison, and I'm chair of the Health Law section at Dowling Aaron Incorporated in Fresno. Employers need to be thinking now about whether or not they may be considered a large employer and subject to the employer mandate, which requires them to offer certain health insurance to substantially all of their employees. And for smaller employers, they also need to be thinking about whether or not they might be interested in premium credits that will be available from the government. The large employer and the small employer both need to think about whether or not their employees might be added together if they have sub-companies or related companies that are part of their overall operations, which potentially could make them a large employer subject to the mandate or prevent them from being eligible for one of the premium subsidies that would be available to small employers under 25 employees. And in addition, those employers who are in the ranges of, say, 25 to 75 employees have to be thinking about whether or not their employees may be considered full-time employee equivalents, even though they are part-time or seasonal, and whether or not as a full-time employee equivalent they might be added to the number of acknowledged full-time employees and throw them into the employer mandate, which applies if you have 50 or more full-time employees